Today, we are discussing about an issue that affects many families, and that is breast cancer. Breast cancer is one of the most common cancers that affect women in Kenya, and also men. Yet, there is a lot of misinformation, fear, and confusion about this disease. There are a lot of myths, like deodorants can spread cancer, that cancer can be spread from one person to another. A lot that we hear and read online that is not true. So today, to help us separate the facts from the myths, I'm joined by a breast specialist.
I'm a breast surgeon based here at KUTRH. I'm glad to be with you, so we can just engage and see what is fruitful for the public to hear.
We can start by knowing what is breast cancer. When we say someone has breast cancer, what really is this disease?
Okay, breast cancer is a disease of breast whereby abnormal breast cells they grow in uncontrolled fashion, mutate and form tumors. And if they fail to be treated accordingly, they end up spreading to the other part of the body. So basically, it's a cancer of the breasts, abnormal cells which grow without being in uncontrolled fashion within the breast, leading to forming a tumor. So it basically is a cancer involving the breast tissue of a woman.
Okay.
Or a man. It can also, it's possible to have also in men.
What are these things that can predispose someone to have breast cancer?
Basically, we divide them mostly into two, like the one which can be controlled and the other one which cannot be controlled. So if you talk about risk factors that can be controlled, is, let's say, cigarette smoking or nicotine consumption, the things whereby it increase the risk of someone to have a breast cancer. So if someone stop or avoid usage of nicotinic substance, it decrease the risk of that person. So that is why I'm saying it's something you can control. It's controlled risk factors. Let's say alcohol consumption. If someone decrease or stop at all, then it's basically is going to have less risk of getting breast cancer. Some if use of this contraceptives and other things, especially high estrogen in female. If there are some currently the ones you have, they're not related to, but there are some which are related. And if so, if someone decrease or not use of it, then we have a less risk of getting breast cancer. Maybe dietary, they're talking about fat, maybe someone is not using fruits and something like that. If someone is going to be taking a lot of fruits, avoid fatty food, something like that. Basically, these are the one which can be controlled. And if you talk about something uncontrolled, being a woman, you cannot control it.
Yeah, true. Yeah.
If you're a woman, 99% you have a risk for that, especially when you reach age of elderly age. So for that one, you cannot stop it. Once you are a woman, you have a risk for having a breast cancer. Also, some like to have late menopause. You can't say that I can control this. Is the nature of the body, and that predispose or increase the risk of a person to get a breast cancer. Let's say if someone, they're concerning someone getting pregnant at a late age, let's say 30s and above, that thing you cannot control. If you haven't been blessed early, then you can't control it, and it increases the risk also.
Does maybe starting periods early also predispose?
Yes, that's the early menarche, you say. Also, that one is something which you cannot control.
Cannot control, yeah.
So early menarche, it's predisposed to increase the risk, of breast cancer.
Okay.
So,
And for a lady or a man who's had breast cancer on one breast, are they at a higher risk of getting it on this other side?
There is a risk of getting the other side, the other breast. And even if there is a risk, there is a history of, they say that benign breast disease, it can lead to a risk of you getting breast cancer. That, but very low, although they contribute to that, some of the papers and other things, but it's not like 100% to say so, no. But it's just they are listed in the list, like it can increase the risk, but it's not something well endorsed, so to say so.
Okay.
Yeah.
And when you say benign breast disease, what does that mean?
Benign breast disease, this is a breast disease whereby of the tissue which are controlled within where they are, and they cannot grow outside that place, and it cannot be, it's not aggressive, it's not invasive, it cannot go beyond where it is. So once it's removed, then you're good to go.
Okay.
Yeah.
So these are like the lumps that at times women can come across, and they are told it's not cancer, so that means it's benign.
It happens mostly, especially in young female patients, whereby they get diagnosis of fibroadenoma, and usually the benign is common. It's not like always we need to remove them. There is indication for it. We usually follow it up, and it's not something which you can say that it increases or it can cause breast cancer. Usually, when it is indicated to be removed, they're removed, and you live happily without any worry. Yeah, just routine follow up and screening when you are due to.
You talked about men. When you're defining breast cancer, you said it can be in both women and men.
Yeah.
And the risk factors for men getting breast cancer, are they the same as for women?
Yes. Breast cancer in male patients is more of the same as the one in female, except for the issue pertaining like early menarche, menopause, because they're men. After all,
contraceptive
usage and other things. Although breast cancer in male patients is very, very low in terms of its incidence. We talk about 1% or less, we can say that. We get cases here, like last month we operated one. It's not common as the way it is in female breast cancer cases. So the risks are more of the same. There's not much different, except those are related to female issue, like being a woman, maybe early menarche, menopause, such things. So for men, they share more of the same as female.
Okay. You know, when we talk about breast cancer, we usually think a lump. But beyond a lump, are there other things that someone can feel or see on the breast that could actually be pointing out to, you know, this can be a risk for breast cancer, or it can be a warning sign for breast cancer?
What I usually advise is whenever you see any changes in your breast, not only a breast lump, any changes in your breast, you just go and seek a medical advice and be checked on that. It's not only breast lumps that are attributed to breast cancer. Even some of the skin changes around the nipple, it can be a sign of a breast cancer. Nipple discharge might be a sign of breast cancer. Or sometimes just not only a breast lump, you can have a lump around the armpit, the axilla. It can be a sign of breast cancer. So whenever you feel like there's a lump, there's skin changes, there's nipple discharge, or any changes that surround your breast which is not normal, anything that is not normal is abnormal to you. So you're supposed to go to a doctor, check on you, do a thorough test if there is a need on that. And then if you're okay, and be reassured on that. Yeah.
So that means we need to really understand our bodies. We keep checking, we keep touching, so that when something changes, then we are able to pick that very early.
It's very important. I always advise the woman, no matter of the age, because, okay, it's true, we're supposed to check on women from the 40s, the way our guidance says, but any woman, I advise whenever they go to, when they take shower, maybe they just examine, just like a routine. They check themselves around the breast. How is there anything? Is there any mass? Is there anything that's changed? And some, usually I tell them, like, you just also put a date or specific date during the month. Let's say after having your menses, because like 5 days from the day that, the 5th day from the day you ended up your menses. You just do a thorough breast examination, knowing that you're okay. Every month do that routinely, and it will be easier for you to detect anything, even if it's minute. You'll easily pick it if you put it as a routine every month. There's a specific day that you do a thorough breast examination by yourself at home, and it really helps to pick a disease at a very early, or in case there's anything, even if it is just benign. Sometimes there's normal changes in breast, which for you, you'll be like, what has happened to me? So you just, once you go to a doctor, and then it's reassuring you that, hey, you're okay, this is normal, it's part of breast changes or something like that. So there are some changes which are normal in breast, which do occur, and usually women, they usually come to our clinic and they're worried, and we reassure them, this is okay, it's normal, should not be worried. We'll just check you maybe annually, or maybe you come for review after 6 months. So it becomes helpful for the patient.
You talked about 5 days after menses. Is there something magical around that period?
Yeah.
Why 5 days, and why after our menses?
It's very important. Usually, even for most of the women, when they just want to do the screening or for breast checkup, we advise not to be close to your menses during your menses. The fact is, breasts become very sensitive during such period, and there are some changes which might be related to the hormonal changes that happens. Yeah. So I prefer after, and best time it will be at least 5 days from there. You can just do, not a must to be on the 5th day from the last menses, from the day that you receive your last day you receive your menses. No, any day from there, but you have to put like routinely specific date. It will be like a culture that you have put to yourself, and it will be always, you'll remember. It will be like, there's something I've missed this month. Hey, I haven't checked myself. So you just examine yourself. In case you miss that date, then you can do it any day from that, the days that you're not having any pain or any issues pertaining your breast.
Is there an indication for screening when you don't have any changes, when you don't have anything suspicious? Is there a place for screening? And if there is, what is the recommended age and the frequency?
Okay, as per our guideline is 40 years and above. We do screening. We usually 40 to 55 years, we do mammogram. That's why I'm saying our guideline is mammogram, and that's standard. Mammogram, we do it annually, every year. So if you're okay, you're normal, and you're 40 years, go to the hospital, say that I'm here for breast cancer screening. They'll do clinical examination, and they'll do a mammogram for you. Once it's normal, then you're going to be reassured, and that's okay, I'm fine. And then every year you'll be coming up to when you're age of 55.
For someone, you've picked these changes, you've probably picked the skin changes, you've probably picked the lump, and they come to you. What is the journey like when this patient comes to you? What should they expect?
So if it is just screening, then we just do a breast examination to the patient, and then it depends on your age. If most of the cases, if they're 40s and above, some centers we do up to even with that at 5, but recommendable according to our guideline is 40 years. We send them for a mammogram. After that, sometimes, mostly, we prefer combining with an ultrasound, because there are some issues that cannot be picked by mammograms, not always. And that's the question patients usually ask a lot. Why? I had that when I'm 40, you just do a mammogram. Yes, we do a mammogram, and that is the recommendable screening modality. But some scenario whereby the breast become dense, or maybe there are some lesion cystic which cannot be picked well by a mammogram. So we prefer doing that. So if there's anything that we have missed on this side, then it can be picked on the other side. So after that, after doing the mammogram, and you come back to the clinic with the result, if it's said that it's normal, then we reassure you that don't be worried, it's normal. You can just enjoy your time, and then you come next year for annual screening. But if there is something that is abnormal, then usually we do a biopsy. And we do it here within our center, and we take a biopsy, and then we analyze it and see okay, what type of disease there is. Is something benign, it's not malignant. Then it says, okay, we reassure the patient. If it's malignant, then we take a journey towards the how to for the modality of treatment. And good enough, at KUTRH we have all the experts pertaining breast cancer, from surgery, chemo, the radio, everything is provided within one center, and it's a good for the patient. And the most important thing is, whenever they come here, they are assured to be seen by a breast surgeon after all. So that's the important part of the treatment.
So for someone who's above 40, we do both a mammogram and an ultrasound.
It's recommendable, but the standard is just we do the mammogram, and then from there they say that maybe it's a dense breast, please you do an ultrasound for that. So it is not conclusive. But you'll find most of or some of the breast surgeons, they end up doing it together. The reason behind is just to adjunct the mammogram in case there's anything, they pick it at the same time. So we are assured. There are some scenario whereby I've seen whereby we do a mammogram, they say it's normal, and then when we do ultrasound, say there is something here, and it save something at the end. So it's not something. It's okay standard to do just a mammogram, but whenever a clinician or a surgeon has requested for both, it does not mean that is want to incur cost. They want to make sure that if they miss this, then they can go.
They can pick it from this other one. Yes. Yeah. And for someone who's 40 years and below, how do we screen for that?
Usually we do an ultrasound, and we check if there's anything. Then we just do more of the same steps as the one we have done for the elders, the one who are 40 years and above.
So from the mammogram and ultrasound, depending on the age, once you pick something suspicious, that's when we go for a biopsy.
Yes, for a biopsy.
And what is a biopsy and how is it done?
Biopsy is a modality whereby mostly we use a technique called core needle biopsy. Is a needle we insert into the breast. We make a small incision less than a sub-centimeter, around 2 or 3 millimeters there. It's very small. And then we put the gun there, which has a needle, and then it goes up to the lesion or the mass where it is, and then the tumor where maybe the mass that we are suspecting there's something not good. So we take a biopsy from there at least 4 times, and then we send it to the lab for analysis.
What we are interested is just getting a small
tissue,
piece.
Breast tissue, small breast tissue. So we do it and then we send at least for analysis.
Now, when the diagnosis comes back and we confirm we have breast cancer, what is the treatment journey like, and is the treatment the same for all the breast cancer?
The breast cancer usually is tailored as per the patient. Not all patients receive the same treatment as the way most people assume. So basically, it depends on the stage and the type of the breast cancer. Not all the patient will go for upfront surgery or will go for chemo. These things will depend on the stage, the early stage, and the subtype of breast cancer. If you are early stage and you have a favorable subtype, then you can be done surgery and then later on you go for chemo. But if it is not an early stage, and I'm talking about maybe stage 3 there, and maybe you can be even in early stage, but you're having a favorable subtype, then you'll have to receive chemo and then later on go for surgery. And after that, it will depend on the stage of the disease, which will determine either you'll receive radiotherapy or not.
This is Afya Connect. We are demystifying breast cancer with Dr. Billel Mohamed. Don't go anywhere. After the break, we will talk about treatment and the truth about some of the myths you've heard. there's always fear that when someone gets cancer, then it means they lose their breast, one of their breast or both. So what are the options for, removing part of it or removing all of it, and what determines that?
Currently, it's not all patients goes for mastectomy as it used to be.
And by mastectomy, you mean?
Mastectomy, removal of the whole breast. Yeah. Currently, it's not like every woman having a breast cancer is undergoing a mastectomy. No, it's not like that. Currently, we do a lot of breast conserving surgeries in our center here and other places in Nairobi. There's a lot of breast conserving surgeries. Usually, we just remove the unhealthy tissue with safe margins, and then you're good. Usually, we mobilize the breast and keep it in a good shape. Sometimes we just mobilize tissue surrounding the breast and we do reconstruction within.
Okay.
And that's very possible. We'll remove some tissue from the breast, and if there are not enough breast tissue around to cover that defect, then we use the fats or the muscle around your breast, and then we just do a reconstruction from there. Some cases whereby if we do a mastectomy, we can do an immediate reconstruction or a delay reconstruction. Some cases we advise to do a delay reconstruction, but in some scenario we do an immediate reconstruction, whereby we remove some fat or some tissue or muscles from the abdomen or the back, and then we create a new breast for the woman. So all is possible. It's not always nowadays is mastectomy, and even if the patient undergoes mastectomy, still we do reconstruction here at K2RH, and many centers nowadays they do that in Nairobi, and we thank God for that. At least there's a good chance for our women, and also for their self-esteem and other things. We're trying as much as possible to make the best for them.
Okay.
The most important thing is for patients is to understand is breast cancer is tailored patient to patient, depend on the stage, the subtype of the breast cancer. Not all will receive the same treatment. We receive some patients telling us, "Hey, Doctor, what's happened? My colleague started with chemo and then surgery. Why are you taking me for surgery, first and then chemo? What's the difference?" So you have to sit down, explain everything, that the reason behind your friend most probably is because of A, B, C, D, and yours is because of this and that, and that's why we're doing surgery and then chemo. And so that's the most important thing. The most important thing is the patient to receive proper information. Why surgery and then chemo, or chemo then surgery? That's the most important thing, because most of the patients, they are wondering. And also why you are doing breast conserving and why you are not a candidate for breast conserving, you are a candidate for mastectomy. So it depends on the stage and the presentation of the disease itself, and also with the subtype of the breast cancer itself.
Okay. So Doc, you've mentioned about the stage, you mentioned about the subtype. How are you able to differentiate? How are you able to stage? How are you able to know the subtypes so that now you know the treatment modality?
Usually after for the subtypes, usually after taking the biopsy will just tell us, oh, this is this type of breast cancer. And then we need to know further by checking something called immunohistochemistry. And that one will determine if it is an estrogen receptor, progesterone receptor positive or negative, or HER2 receptor positive. So these three, there's another one called Ki67, but I'm just talking about these three. The one most of the patients, they hear much. So if these four markers present either being positive or negative, either of that, it will determine now this is this subtype or it is this subtype. And then the issue of staging, now the patient after doing the biopsy, then we confirm the immunohistochemistry. After that, now we'll send the patient, or even after just getting the diagnosis of breast cancer, while we're waiting for the immunohistochemistry, we'll send the patient for a CT scan. That's initial staging modality. CT scan, we do abdominopelvic and chest CT, and it's going to determine which stage is it. So if it is an early stage within, then it's going to tell us it's just an early stage. If it has gone beyond, it's going to tell us it is metastatic.
Okay.
And we have a PET scan at the moment, which it can be used, but it depends case to case. Not always we send for PET scan. Yes.
So the CT scan and the PET scan is what will help us now stage, which will also determine our treatment.
Our treatment modality also, yeah.
Now, after we've started treatment, is there a possibility of ever being declared cancer-free?
There is a very big possibility. I can say that for sure. Like in our center here, many centers nowadays, we have a good team in our country. We have enough breast surgeons and surgical oncologists and clinical oncologists who are handling all over the country. Successful rate is high currently. It's not like the way it used to be. So we encourage to do a breast screening, breast cancer screening, is to get the disease at an early stage. And if you get an early stage, survival rate is very high. It's very high. And if you do it at early stage in a favorable breast cancer, believe me, it's 90% and above. Survival rate is high. And we have a lot of breast cancer warriors. In fact, even at our center, the good thing about here is even some of the staffs here, they are survivors of breast cancer, and they've been living for many years as cancer free. So I say that the most important thing is to go early, to seek medical advice at an early stage, and to get the right experts. That's the most important thing people should understand. The right experts who can pick the disease and can guide you well in the line of treatment.
I know there's a lot of myths and misconception about breast cancer, just as there are so many myths about other diseases. So what are some of these myths that you encounter, things that patients or their relatives will ask or they've heard from out there? Medically, they are not right, but in the community, those are some of the things that people believe in.
Okay, the myths like someone saying that maybe being contagious or something like that. Breast cancer is not a contagious disease. It cannot spread
from one person to the other.
To another person. So that's just myths. It's not the reality. Breast cancer is like any other disease, like the cancerous disease which I talk about. So that myth supposed to be avoided or to be guided to the community that it's not like that. Or maybe if you wear a certain type of bra, you're going to get a breast cancer. It's not like that. Most of the cases, we don't know even what causes breast cancer.
I've had people say that use of deodorant can expose people to breast cancer. Is that true, or it's one of the other myths?
It's one of the other myths, because if that is the case, then
most of us,
it could have been almost 50 or 60 or more than 50% of Kenyans they'll be suffering from
breast cancer.
But that's not true. It's just a myth.
Okay. Now, for a family where one of their loved ones gets breast cancer, what kind of support does this patient require from the immediate family?
They need to be part of her or him, let's say, to give all kind of support, social support, financial support, being close to her. And they should not put the mentality like, he's having a breast cancer, then this guy is quisha, it's gone. It's not like that. And I always tell people, you have to be supportive.
True.
Live life. It's like any other disease. It's not like a death sentence.
True.
Even that, it will enable that patient to divert her mind from those thoughts of breast cancer issues. Will live happily. And when this person is living happily, even her body immunity become good. In fact, it will help fighting that disease. So I think the most important thing is to be part and parcel of that family member who is having a breast cancer, support her in any way, socially, financially, being close to her. And we should not neglect them, telling that, hey, Quisha, or something like that. No. we should just live like normal, like like it's like any other disease. The most important is when she needs or he needs financial support, you're supposed to be there for her.
Yeah.
It should not be a burden.
Yeah.
If you can, please help, because she is in need or he is in need. We need to support one another.
Yeah.
Even you can go together to the hospital with the family member, the one who's suffering, be close with her, move out together, arrange some family meeting gathering, just normal things, and we live happily.
And as we come to an end, Doc, I know we've discussed a lot. For anyone out there who's listened to this talk or this interview, what are the 3 things that even if they were to forget everything else, these 3 things you should not forget about breast cancer?
The most important thing is to do their self-breast examination. It's support any woman wherever she is at home should remember that she needs to check her breasts. The breasts are meant not only for breastfeeding, other things. The most important thing, that's a very crucial organ and part of your body that it have high risk as compared to any other part of your body can get a cancer. So what I'll advise is self-breast examination. Second, to go for screening. Third, to do a follow-up when there is a need.
Thanks, Doc. We really appreciate your time.
Thank you so much. I really appreciate